Catherine Clair, and I come from our Performance Measurement Department here at NCQA. And I am really excited to tell you about our research project, Health Plan Strategies Supporting the Safe and Judicious Use of Antipsychotics in Children and Adolescents. And this work was funded by the Agency for Healthcare Research and Quality and Centers for Medicare and Medicaid Services, funded under the Pediatric Quality Measures Program. So we conducted a qualitative study with health plans to understand the activities and strategies that contribute to high or improving performance on two of our quality measures. The first measure being the use of first-line psychosocial care for children and adolescents on antipsychotics, and the second being metabolic monitoring for children and adolescents on antipsychotics. So to give some background, qualitative research is a way of gathering non-numerical data. So instead of doing a survey or asking for numbers, we interviewed 11 health plans. Now this study addresses the issue of safe and judicious use of antipsychotics in children and adolescents. So, 1, are youth receiving appropriate care before starting the antipsychotic? And 2, are youth receiving appropriate care when on the antipsychotic? This research is important because we know from our performance data that youth without an FDA indication for the use of antipsychotics are getting these medications before first trying guideline-recommended psychosocial care. What does that mean? FDA indication means that the Food and Drug Administration has indicated that a medication is appropriate treatment for a particular condition. So, youth are being prescribed antipsychotics for conditions where psychosocial care would be recommended as the first-line treatment. Additionally, these medications have powerful side effects, and kids are not being monitored for the metabolic impacts, such as elevated cholesterol and glucose levels. This study helps NCQA understand the contextual factors and the health plan level factors that might impact kids getting recommended care. We hope that health plans can take the health plan level strategies and activities that we identified in our interviews and implement them at their own plan. They can also see how contextual factors, such as at the state level, can impact their performance. The goal is that this will lead to more appropriate care for children and adolescents on these medications. By understanding best practices and lessons learned, health plans can have a more informed idea of how to improve not just measure performance, but overall quality of behavioral health care provided to youth. Thank you.